You say many women regret that they didn't go bigger.
When most women come in, they'll say, I don't want my implants to be too big because they're worried about certain credibility issues.
Okay.
Having people not take them seriously because of a large implant or large breast size. And they'll usually pick a smaller size than they would have wanted to pick, and then after their procedure, when their swelling goes down a bit, they regret not having picked a slightly larger size.
So in that case, and somebody,
Right.
you know that they may regret this, I mean, do you just tell them? You tell them the story like you're telling me?
Well, yeah, I do that, but I also have them try on a range of implant sizes, both smaller and larger than what their initial choice was, to make sure that they're comfortable with that. I also tell them that until the morning of surgery, they have the opportunity to change their minds and pick a slightly bigger or smaller implant if that might be the case. Let me show you some examples, Randy. This patient here is a 28-year-old woman, about 97 pounds, very small frame woman who had seen another doctor, and she was very distressed because her nipple areola complex is small. And the other surgeon had said the only way to do this surgery for her was to go through the inframammary folder under the breast. In my opinion, for this patient, placing an incision in the fold could have been problematic, especially with wearing a bathing suit.
She's very lean.
Yes, and she does not have much breast tissue at all. Okay. This would limit the amount of ptosis or sagging that would hide an incision under the fold. So with her, and with many of my other patients who are small and have small areolas, I'll use pediatric instruments to make a very small incision, and it takes a little bit more time. But the results are great, as you can see here. She has an incision in her areola, and you can't really see it.
And those are not touched up?
No.
Okay.
And what I brought several other examples of different pre-op and post-op results so that the average woman is represented here.
Okay.
And all of these have been done the same way, a dual plane technique, going through the nipple areola complex. And as you can see, they have very natural results with incisions that are minimally detectable, if detectable at all. I mean, you have to have close scrutiny here to be able to see these incisions.
Now, at what point does somebody need a lift or just an augmentation? After pregnancy, they start losing, I guess, starting to develop sag or lose volume?
A breast is made up of both fat and breast gland, and with age or pregnancy or both, you have a loss of fat and breast tissue, and what happens is the breasts begin to sag or become more ptotic, and with time this ptosis or sagging can be significant enough to be distressing to many women.
But a lot of women, in anticipating this interview,
right,
talk to some people, and the big fear is the incision, the scars.
Sure.
That doing a lift is a disaster.
Well, yeah,
what is your response to that?
They have, they'll say things like, I don't want those Frankensteinish scars, or I don't want that anchor type scar. And it's because they've seen many scars that were not ideal, and they're afraid of it.
But that's in the hands of the surgeon, you say?
A lot of it has to do with technique. Some of it, there are patients who have healing issues, and that's genetic, and it represents their typical healing, which is not great. But what the doctor can control is the size of scars, the placement of scars, and the attention. Once again, it's all attention to detail. If you spend a lot of time closing these wounds...
You spend 40% more time, you say?
I think so. I think so. A lift will take me 3.5 to 4 hours to do. And some people think that's a lot of time, but my results speak for themselves. I spend a lot of time with my patients after surgery as well. I do my wound care myself. I like to be very, very in control of what's going on with my patients.
Now, you have some of these lift photos.
Yes. Most of the photos that I brought here for you today, Randy, are 3 months after surgery. So the scars have not matured completely, and even though they're only 3 months out, they're minimally detectable.
I hope we could show this on TV, because and these aren't touched up, as you said.
No, not at all. And I brought various...
What a huge improvement.
It's a huge cosmetic improvement, but it's also a huge life improvement for many of these patients. There's a lot of insecurity, a lot of self-consciousness.
What do they tell you, by the way?
Well, they tell me they don't have relationships with their significant others with the lights on. They would just love to be able to wear a T-shirt without a bra, and feel comfortable that way. They would just love to feel younger again, and they associate having breasts that look like they once did.
So a lot of women out there with saggy breasts.
Yeah.
that'll tune in the show, but their number one fear, you say, is the incision.
Yeah, incisions, right. They would be happier having breasts that
I mean,
look
anybody watching this, I mean, this is clearly
right.
nothing
But
to worry
it's
about.
because they haven't been exposed to these type of results. There are many competent plastic surgeons who do excellent work, but there are lots of results that aren't ideal.